Bismillahirrahmanirrahim. In the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum to all of you. Myself, Alisha and my department is BS Biochemistry. And today we are going to discuss a beautiful myth of methionine. So we must have some sort of information about methionine because it plays very important role in our body. Starting with the contents, we have to discuss its intro, then methionine pathway, structure of methionine, supplementation of methionine, symptoms of methionine, then its functions, types, and then is the benefits of methionine. Okay, let's move our right to methionine. What is it? Methionine basically it is an antioxidant and it may help protect the body from damage caused by ionizing radiations. It may detoxify harmful substances in the body like heavy metals and may also prevent liver damage. Liver basically is a major organ of human's body and that produces blood concentrations in our body. And the use of blood is the inhalation of oxygen. So the next slide is methionine pathway. Methionine is a biosynthetic pathway that proceeds from O-acetyl homoserine in two branches, which either directly forms homocysteine or proceeds through cystathionine to form homocysteine. Homocysteine on methylation by homocysteine S-methyltransferase yields methionine. Methionine occupies a central position in cellular metabolism, which is the process of protein synthesis methyl group transferred through adomate, polyamines and ethylene synthesis or interlocked. So this is the pathway of methionine or reactions of methionine. The pathway starts from the most important acid that is called oxalic acetic acid, which is converted into aspirate, and aspirate on further reaction is converted into aspirate semialdehyde, which can react into two ways. From one way is lysine that is formed, which is also an amino acid, and from the other way homoserine is formed, which I have discussed in the previous slide, that it further proceeds into two branches, which either proceeds into homocysteine, which is in the converted into the final product methionine, which we want, and the other proceeds into homoserine phosphate, which is then further converted into two other important amino acids of our body called threonine and isoleucine. Here we can also see the importance of oxalic acetic acid, which is eventually yields four different types of amino acids like that: lysine, methionine, threonine and isoleucine. Here we can see that in addition to methionine, we can have three other kinds of amino acids, in which includes lysine, threonine and isoleucine. So basically these are the other three important amino acids that is present in our body, like human's body. So they play a very important role in our body. Now its structure of methionine. So methionine is one of the two amino acids that contains the element sulfur and the other is cysteine. The chemical formula of methionine is C5, H11 and O2S. In general, all amino acids have the same structure: an amino group attached to a hydrogen and carboxyl group and a slight chain denoted by R via central carbon. Central carbon is also called a chiral carbon, and which is not directly attached with hydrogen. Here is the detailed structure of methionine. As we described earlier, basically formula of methionine is C5 carbon, means that 5 molecules of carbon, and now we see that in the molecular formula detailed structure: carbon 1, carbon 2, carbon 3, 4 and then 5. So our 5 molecules of carbon is completed, and now 11 molecules of hydrogens. So these are the 11 molecules of hydrogen as As we see in the structure of methionine, like hydrogen 1, hydrogen 2, 3, 4, 5, 6, 7, 8, 9, 10, and then 11. So now the molecules of hydrogen is also completed according to our formula. Now the molecule of nitrogen is 1, oxygen have 2 molecules, and then the sulfur is only 1 molecule, as we see in the structure of methionine. So 1 molecule of sulfur and the 2 molecules of oxygen, and then the 1 molecule of nitrogen. So now we have completed the structure explanation of methionine. So now we have discussed about the supplementations of methionine. Basically, we can better understand this is by using an example, like whenever we got a fever or other symptoms of some diseases, the doctor prescribed us medicine in a fixed supplementation. Similarly, there is a fixed supplementation of methionine. So now let's have a look. Despite an adequate vitamin status, the supplementation of 1500 mg of L-methionine daily significantly increases homocysteine plasma concentration by an average of 2.0 micromole per liter in patients and in control subjects. An optimal vitamin supplementation, especially with folate, might prevent such an increases. Now here is the another pathway of methionine, in which the precursor homocysteine starts the reaction, which is converted into methionine, which is on further metabolism gives SAM, and SAM then proceeds into 2 different ways. The one is that SAM proceeds to DNA methylation, and the other is that it is converted into SAH, which again gives a homocysteine and then eventually proceeds to methionine. So this is the pathway of methionine. So now let's discuss the symptoms of methionine. Symptoms that have been described include problems with psychomotor development or intelligence, and the other is tremor, like we feel body shivering, then abnormal muscle contraction, in which we are unable to move our muscles like its movement, then lack of control involving range of movement. It also gives us this sense of like muscles contractions, which includes then severe headache. Severe headache is a common symptom. Then abnormal eye movement, and then impaired ability to make rapid alternating movement. So now it's the functions in human body. As we said earlier, methionine basically is an antioxidant, and that it helps protect the body from damage caused by ionizing radiation, and it may also help that it may detoxify the harmful substances in the body like heavy metals, and also prevent the liver damages. So methionine basically is to help to prevent the hair loss, and thanks to its sulfur contents like cysteine. This sulfur ingredient helps strengthen hair and reduces risk of breakage. So methionine contains properties that protect hair from free radicals so they don't harm your hair structure. So please take care of your hair, and as you can see, methionine plays very important role in growth of hairs. So please take care of your methionine as well, and try to eat healthy foods that contain maximum methionine level, as these are the blessings of God. Types of methionine. Methionine is an essential amino acid. Essential amino acid means those amino acids which our body is unable to make, and so we have to take it through our diet. That occur in 2 types, DL-methionine, and the second one is L-methionine. So a scientist called Fisher says that all amino acids that occur in nature are of 2 types, which are the mirror images of each other. Talking about methionine, it also has 2 mirror images. The key difference is between DL-methionine and L-methionine is that DL-methionine is a chemical mixture of D and L enantiomers of methionine, whereas L-methionine is that L enantiomers of methionine. Benefits and symptoms of methionine. So an essential amino acids for healthy skin, hair, nails and more. So these are the benefits of methionine, and now we discuss about the its symptoms of methionine. It includes are headache, heartburn, nausea, diarrhea, dizziness or drowsiness. Don't treat yourself with methionine. It's possibly unsafe to use methionine by mouth or to self-medicate. Too much methionine can cause brain damage and death and may be fatal. Thank you for your precious time. I'm really pleased that you have watched the video, as it is related to our health. As you can see that it has major important role in liver and skin and then hair, etc. Moreover, I want to thank our most respected professor, Dr. Hammad Majeed, that he gave us opportunity to enhance our knowledge and show our abilities also. Thank you so much once again. Have a nice day. Allah Hafiz.